I'm Carrie Cochran-McClain. I'm the Chief Policy Officer at the National Rural Health Association. And while I have lived in DC for far too long, I am originally from Missoula, Montana. I have fifth generation roots in Montana. I'm really delighted to be working with Carrie Henning-Smith this year as NRHA president. The two Carries, a strong, mighty duo, and very honored to have been nominated for this award today. I really truly believe that people should have access to care no matter where they live, and I have been lucky enough to work my entire career on access to care for safety net populations, the majority of that in rural health. And I feel so incredibly lucky to be part of that NRHA family. And we are doing a terrific job of bringing rural health into the spotlight. If you think about the fact that rural hospitals were a significant focus in the debate around HR 1 and the changes to the Medicaid program, while we weren't successful in stopping those changes, we were successful in getting rural hospitals a key part of the debate, and $50 billion devoted towards rural health transformation. While rollout and implementation is never perfect, we are very hopeful that this will make a huge difference for rural America, and proud to be just a little part of that along with all of you. NRHA means family. It means family kind of at all levels. It means the fabulous collaborative environment I get to work in here at NRHA with an extremely talented government affairs team, with an incredible leader in Alan Morgan and all my phenomenal colleagues at NRHA. It means getting to work with one of the best memberships around. The folks who are members of NRHA are just, I feel incredibly lucky to know so many committed, passionate folks who want to lift their voices to Capitol Hill and to the administration. And it means that we are all working towards and for rural families across this country who will get to live their lives in the communities they love, doing the things they love in a robust, healthy way.
The thing about Carrie is that it's not just one moment or 1 year of advocacy and driven policy. It's about a million little moments. I could put so many of those in context of when we were having a big push on HR 1, when we were having conversations about how RHTP was going to be rolled out and implemented, or the support that she gives our state associations and all of our community members and all of our membership. And she was able to provide the steady hand that she always does in ensuring that rural is always the top priority, but it is never more important than remembering the communities and the people that you work with.
Just the last whole year of 2025, where we were fighting so many different fights in DC, from cuts in the president's budget to the reconciliation process. And she was just so dedicated to ensuring that rural was represented, heard, and made it out of those as unscathed as possible. And she did a fantastic job.
I think Carrie goes above and beyond always for our team and for rural communities. Carrie is a pioneer in this field. She truly knows how to lead and include multiple voices, multiple perspectives, and use that passion to drive change for rural communities.
Carrie just has such a passion and dedication to rural health that's truly infectious. So I think wherever she goes and wherever she talks about uplifting rural communities and improving rural healthcare access, people tend to care and listen a little better. I think the way she brings the team together and has really created just such a strong team, such a sense of family on the government affairs team, and that just makes it so much easier to come to work every day and do what we do.
Carrie has a very unique way of leadership in which she really uplifts the team. And I have never been in a team environment so supportive and welcoming and fostering towards everyone's likes, dislikes, passions. And you can really see that with our team and the work that we put out, that we are all very passionate about it.
Carrie, at her core, is like the mom of NRHA. She truly cares for the staff in the way that she would care for anyone in her own family, and we are so incredibly grateful to have her, myself as a boss, but us on our team every single day. I'll take my last second just to say, Carrie, we love you.